Katoa. Welcome to today's presentation, Ngā Paerewa Health and Disability Services Standard 2021. We will be discussing, as hopefully you all know, Section 2, Hunga Mahi Me Te Hanga Workforce and Structure. All of my words today. Before we get into introducing ourselves too much, I would just like to thank you all for coming and welcome you all with a karakia. And to start off this session, I will be putting up the words so you can, you're welcome to join me if you happen to know this, but otherwise you can understand what I am saying. Whaia, 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 ngā waratanga o te manatu haora. Ko te manakitanga, ko te katiakitanga, ko te whakapono, ko te kokiri ngā tahi, kia tai atu tātou ki pai tata, ki pai tawhiti, ki pai ora, kia tuturu, kia whakamoa, kia tina.
Tina.
Homie, huie.
Taiki.
Wonderful. Oh gosh, yeah. So thank you for coming. My name is Koje Sankara Tako Ingoa. I am Principal Advisor, Quality Assurance and Safety, but was also the project manager which supported the review, as perhaps some of you know, of Ngā Paerewa Health and Disability Services Standard. So fortunately can bring quite a bit of context from that experience, which was an absolute gift over the past 2.5 years of reviewing and updating the document. And joining me today is my subject matter expert,
Christine Masters, Principal Advisor from HealthSet. Thanks, Jade.
Wonderful. So we will be providing a good overview of the Section 2. So firstly, just to confirm, we are recording this session. By attending, you are providing your consent. So all sessions are going to be recorded and they will be made available on HealthCert's website. You will receive an email when they are uploaded. We will be answering questions at the end of this session, so just make note or send them through to, I'm looking over at my colleague Gail. We have a team of HealthCert here in the room, and we'll be putting them on Post-its and then we'll answer them at the end of the session. And finally, to confirm, we will be publishing these slides on our website. Of course, there will be some sign-out process, so it won't be immediately after the session, but again, we'll let you know when they are available. So before we get too far into today's discussion, I would like to hear a word from our main sponsor. Perhaps a few of you recognize him, our Chief Executive. I just realized you might not include. I don't know why. Two seconds.
I'd like to introduce you to Kia ora koutou katoa. I'd like to introduce you to Ngā Paerewa, the Health and Disability Services Standard. The standard outlines what we can expect in New Zealand to ensure that we provide high quality and safe health and disability services. The standard applies to a wide range of health and disability service providers. It was developed by the sector for the sector, with oversight from Standards New Zealand and the Ministry of Health to ensure the process was robust and transparent. So, the updated standard is the result of many voices coming together over a period of time to determine how we can provide better services for New Zealanders. I'd like to take the time to thank all of those involved in updating the standard, and I commend them to you in your work in future. Thank you once again for your input. Ngā mihi nui, kia ora.
Right. Wonderful. So thank you to all of you who I'm sure a number of you online have participated in this review, so thank you for that. And we're excited to share with you what those updates are. So quickly on the 2021 standard, as we'll be referring to it, it was made available on Standards New Zealand website on the 30th of June. We, the Ministry of Health, have paid for free access, the best access that we can buy from Standards New Zealand, which means that you can all now download, and the key difference being and print the 2021 standard for free. So it is accessible. If you want a fancy bound one, you can purchase one. It's much more cost effective than the last version. I think it's about 70, just under 70 New Zealand dollars. So if you want the nice version, and that's the link to the Standard New Zealand website, which is also on the Ministry of Health website. So what we will be covering today, we're going to provide some a quick context. So we'll outline, we've undertaken a mapping analysis summary of the 2021 standard to the 2008 Health and Disability Services Standard, the Home and Community Support Sector Standard, the Interim Standard for Abortion Services, and the 2008 Health and Disability Services Standard. We'll talk a little bit about the criteria application framework, which is a new thing within the 2021 standard. And then we'll also discuss briefly the updates to the sector guidance. We'll then focus in on section 2 itself, focusing in particular on what is new based on the mapping. So we won't focus on what you hopefully are all generally familiar with. And then we also consider how to use the sector guidance for these new topics. And then we will take questions at the end. So there is a detailed overview of the mapping, etc., on the website. So we're kind of assuming that you do, those of you attending do have a general understanding of the broad changes between the 2021 standard and the former and the current standards. But if you don't have that, we do have quite a bit of information available on the website, and that's the link there. So this slide is important because it's, so we have health certs. I look at Christine, have undertaken the official mapping of the 2008 standards against the 2021 standard, and this also does, of course, include home and community interim standards for abortion services. So this is the mapping that we will use to underpin the DA handbook interpretation and those sorts of things. So that's quite important because that's how we'll be viewing it here within Health Cert. And the language that we use is we've categorized the mapping into 3 elements. So there's mapped, the 2021 criteria directly mapped to the criteria in the 2008 Health and Disability Services Standard, or other standards. The criteria is either the same or has the same intent. The wording may differ slightly. Partially new, partially mapped. There's partial alignment. The 2021 criteria is either similar to current criteria or the same as most of the current criteria, but with an additional element. And the wording likely differs, and this is generally because to reflect current accepted best practice. Then there's new /unmapped. So this is new. Criteria does not map to anything in the 2008 standard. The criteria is new to the 2021 standard and has been added to assure safe services to New Zealanders that reflect current models of care. So that's the general language that we will be using. The other key thing to touch on is the criteria application framework. So there is an element of this currently in the 2008 Health and Disability Services Standard, but we've taken it a step further. So not all criteria is applicable to all service types, and we have outlined this clearly at the front of Ngā Paerewa Health and Disability Services Standard with this criteria application framework, and so it indicates what criteria does apply to different service settings, and this listed in the sector guidance document. And further in the sector guidance itself, we have broken it down again. So there's service specific guidance, which allows you to understand how the criteria are to be applied in your particular setting. So the intent here was to kind of deal with the different settings in which you might want to have make sure that residents or people in your service are aware of their rights under the HDC Code of Rights. In a hospital, you might have a poster outlining the rights, but when you're in someone's home or residential setting, it might be something a little more discreet. So we tried to capture that in the guidance, and that was an intent. The other thing that is big and different, if you have the 2008 standard in front of you, or just know it like the back of your hand, you'll know on the left-hand side is the guidance and on the right-hand side is the criteria. We have uplifted the guidance out and it is now available on the Ministry of Health website. We have done this for two reasons. The main reason being that now the sector guidance is a live document. We can update it more regularly to reflect research, updates and models of care, these sorts of things, perhaps upcoming pandemics and changes to IPC protocols and advice, for example, and also updates from the sector. This is an easy thing to print. You simply need to expand the sectors that you are interested to see the guidance for, press print, and it will automatically adjust the size of your paper, so hopefully a bit easier as well. We will have a mechanism in place we do have a mechanism in place for the review of the sector guidance. And so if you would like to be notified as part of that, when we do updates, just email certification at health.govt.nz. And I see someone's asked for the link. The link is on the slide, but of course, I'm sure Gail will shortly be sending that through on the chat. And now you get to hear someone else's voice other than mine, Christine.
Thanks, Jade. So I just want to talk a little bit about the implementation and transition plan into going live on the 28th of February 2022. So once we go live, what we are aiming to do is to have a staged, transparent and non-punitive approach, something similar to when we implemented Intera into the sector. For those that were familiar with that, and particularly the ARC sector, aged residential care. So where we've got any new or unmapped criteria, and where we've got any partially new or partially mapped criteria, there are going to be applied some grace periods before you're expected to be fully implementing that criterion. So for completely new criteria, we're expecting that there will be a 12 to 18 month grace period starting from the 28th of February 2022. And where there's something partially new, so some familiarity, but within that an element of something new in the criteria, there's going to be a grace period of between 6 to 12 months from the 28th of February 2022. And those grace periods will be informed further once we've completed some audit pilots. So what we're doing to test the implementation and our processes in HealthCert to ensure a smooth transition from the 2008 HDSS version to the Paerewa 2021 version, we're going to be running a series of pilot audits between August and November this year. So we're going to be running these at the same time as a scheduled DAA certification or surveillance audit, and we're going to be ensuring that there's no additional audit burden in the sector for suggesting we might have an audit pilot that sits outside the certification framework. So we're going to do 2 audits on site at the same time with 2 different teams. So the DAA certification or surveillance audit will just run as you would normally expect that to run. There'll be no impact at all on the certification cycle or the outcome of the audit. That will run through the current processes that are in place at HealthCert as it stands currently. And what the audit pilot will do is test the new systems and processes that we'll need to run through HealthCert through the process to ensure that we've got those processes right. So when we switch over to the Paerewa standard, we've got similar and appropriate transition to that for certification cycles, etc. We're asking providers and DAAs to volunteer to take part in that process, and we've had some feedback already over the last couple of weeks of good interest in this. And we're going to also be doing this in a variety of settings. So we're going to run a number in the ARC sector, we're going to run a number in the residential disability sector, including psychiatric services, and also in the private sector, so hospices and maternity units, and any private hospitals are also interested in joining that. The audit pilot team will be a health cert approved auditor team. And in terms of how we might be able to support you in addition with the implementation, so we've got these workshops running. We're also developing an e-learning module to support the Te Tiriti component of the standard, and we'll let you know when that's up and running. There's a lot of resources available on the sector guidance on the website to help support starting to think about how you might implement things for your own service. We've re-established the Health Cert Bulletin, and we're going to be releasing the DAA handbook later in the year once it's been aligned and with the Ngā Paerewa standard. So we're wanting also to get your feedback from the sector around implementation, and we're going to be running a survey along with the workshops. Now, these surveys are going to be run about 2 to 3 monthly to ensure that we can just touch base with the sector to understand what you might need, and then we'll try and support those needs through including those topics into these workshops in the future, or answer questions through the bulletins and so forth. So we also want to know what events or conferences or workshops might be happening out in the sector nationally, so that we can support implementation and come and speak to some of these meetings. We're not going to be able to attend all of them, of course, but we're really interested to know what you might be having on between now and the end of the year that we might be able to come and support. So moving on to section 2. So with the focus of these workshops, we're really wanting to just really focus on the new or the partially new criteria. So if you attended one of the other sessions, you will have noted that about 75% of the 2008 version of the HDSS standard is actually mapped across. So the majority of the criteria that we've got in the Ngā Paerewa standard is actually familiar to the sector. So less familiar for fertility, home community services, and also the abortion sectors. But we're going to be running some targeted sector workshops to support those and individual service types later. So section 2 is about workforce and structure. There's 5 subsections, so this is a new language. So previously in 2008, we called them standards. So we're now calling these subsections. So we've got 43 criteria within this section, and we've got 5 partially new criteria, so some new elements, but some familiarity in the criteria. And we've got 11 criteria that are new. So section 2 covers 5 subsections. We've got governance, quality and risk, service management, healthcare and support workers, and information. And you can see within those there are a number of varying different numbers of criteria, and we're going to go into those in a little bit more detail, particularly the new criteria and the partially new. There's a very busy slide and we're not going to read it or go through it. Really, it's just to highlight that for subsection 2.1 there's 11 criteria, and within that there's 3 that are new or not mapped, and there's 1 that's partially mapped, and we're going to go into those in more depth now. So 2.1.5 is a criterion under the subsection 2.1, which is about governance. So the governance bodies here need to ensure that outcomes, we want to improve outcomes and ensure equity for people with disabilities. So the focus here is around looking at Ministry of Health strategies, particularly around He Koranga Oranga Māori Health Strategy, and also looking at government strategic directions for achieving outcomes such as the equity of healthcare for Māori, a framework. We want to ensure that services are collaborating with mana whenua in business planning and service development. And we want to see that there, where a provider doesn't have a governance body, so for instance, perhaps it's a very small service type or residential disability, that there is some way in which they can meaningfully evidence that they've got decision making in place around how they would be implementing this criterion, and that would be being reflected in the services provided. So the sector guidance really is just an opportunity to look at how you might do things for your own service type, and we want to encourage creativity and innovation, and it needs to be relevant to the size of your service and the type of service that you are providing. 2.1.6 is also a new criterion, and this is about governance bodies identifying and addressing barriers to equitable service delivery. So here we've got business planning, strategic and business planning documents that we want to see that they're aligning with some of these strategic documents that we have nationally. So Ministry of Health Disability Support Services Strategic Plan, and we've got the Whaia Te Ao Marama 2018 to 2022, the Māori Disability Action Plan, as resources and references to support your progression and being able to maintain or implement this criteria. We've also got government strategic directions, not just around Ministry of Health or Ministry of Disability or disability support. And we want to ensure that there is meaningful representation on the governance body of tangata whaikaha, so those with Māori individuals with disabilities. 2.1.7 is partially new. So this is a criteria where some of the criteria within it is familiar, and it's about ensuring support for people receiving services. We have people participating in planning, implementation, monitoring and evaluation of service delivery. So that in itself is not new, but what is new is ensuring that this is also accessible to whānau as well as all people receiving services. So for this, we're wanting to help providers understand what their cultural risk is, or what your cultural risk is for your service, and what it is that you might implement to mitigate that risk. So it's about thinking what is relevant for you and your service. We want to suggest considering or adopting national guidelines. Again, we've got a lot of references there for you to be able to link to and review. For example, Nursing Council guidelines for cultural safety, Treaty of Waitangi Māori Health and Nursing Education and Practice, and the New Zealand Medical Council Statement of Cultural Safety. We also want to ensure that governance bodies are applying an intersectional lens when they're addressing barriers to service provision. So why this is really a partially new element is we're doing a lot of this in practice across most of the service types. However, what this is asking for is it to be provided also at a higher level, at the governance level. 2.110 is also a new criteria within this subsection around governance, and it's about governance bodies demonstrating expertise in te tiriti, health equity and cultural safety as core competencies. So it's about ensuring that at that governance level there's training available for governance body members around te tiriti, health equity and cultural safety, and ensuring that for those that are leading organisations and providing governance, that they too understand there is supporting this and not just those providing services on the ground. We want to see that on the governance body there's an executive leader that's actually championing Māori health and equity. And again, there's lots of tools available, and these are just a few just to have a look at on the website. But of course, there's a lot more out there than there are in the suggestions and the sector guidance. So we're going to move on to subsection 2.2 now, which is around quality and risk. So again, you can see that there's actually 8 criteria in this section, and there's only one criteria, 2.2.8, which is actually new or not mapped, and there's 2 here that are partially mapped. So there's some new element to the criteria, and that's 2.2.4 and 2.2.7. So 2.2.4 is partially new, and with that we're wanting service providers to identify external and internal risks and opportunities, including potential inequities, and to develop a plan to respond to them. So the first part of this criteria is something that we expect for all service providers, and that's around your risk management and ensuring that there's mitigation around risk. What's new to this is the second half of the criteria around ensuring that this identifies and includes potential inequities, and then what is it that the service is going to do about that in terms of how will the service plan to respond to that, to ensure that those potential inequities are identified and then mitigated or actions put in place to manage them. So the sector guidance around this, there's a number of things that are particularly familiar with the sector, and the majority of these suggestions are things like a SWOT analysis or a SCOT analysis to determine what your strengths, challenges, opportunities and threats are. Strategic planning around ensuring that staff and people receiving services are included in the development around service planning and strategic planning. Benchmarking against performance indicators. So this is also quite common in the sector in most of the service types. Including business continuity as part of the annual planning processes. So this again is something that the sector does, and all service types will be familiar with this. And internal and external risk assessments, again, this is familiar because it's part of the risk management and mitigation for determining response and level of risk and managing that. That's not new. Internal and external risks, we're wanting to ensure that feedback is sought to manage these, and again this is something that providers do on a regular basis, such as surveys and focus groups, and feeding that information back, and that's something that is certainly evidenced in audit. What is new is around demonstrating the quality improvements that are embedded into practice. Now, these quality improvements that we're talking about are around the identifying of inequities, and developing a plan around that. So what quality improvements are going to be made around that are going to be embedded into practice? And these include the usual things too around incidents, adverse events, complaints and investigations. So we're wanting to ensure that there is a way in which we can determine potential inequities and developing the plan really to respond to them. So that's the biggest addition to that. 2.2.7 again is a partially new criteria where we've got the requirement for providers to ensure that their staff are delivering high quality healthcare. So that's not new. What is new here is the focus around delivering high healthcare for Māori. So with that, again, we've got some resources on the website around the sector guidance to support this, and it's things such as ensuring that we've got analysis of staff competencies, and that the service is supporting workers in training and development where any gaps are identified. And you want to probably think about how you're going to include things like te reo and tikanga Māori in the ongoing learning processes. So understanding and using Māori models of care, health and well-being, in addition to what you're currently doing. Having the capability to also use cultural intervention practices and approaches to Paerewa. So collecting quality ethnicity data and understanding the rationale for doing that. So some service providers actually already are doing this and evidencing the ethnicity data, and sometimes it's a contractual component within the service to deliver this, but now the standard is now requiring this. And we want to also see that in some way each service provider is partnering and participating with iwi and Māori organisations inside and outside the health sector to help support service integration, planning and support for Māori and their whānau. 2.2.8 is new. So again, this is a criteria which is a brand new focus and a new criteria. And what we're wanting here to see is that service providers are improving their health equity through critical analysis of the organisational practices. So it's about an organisation thinking about how they're going to review and critically analyse their own practices to ensure that health equity and improving this is relevant to your service type and what it is you might be doing to evidence this. So you might think to have some policies developed or some processes around what you want to see for your service type that's relevant to your size and scope. What training, again, might require your staff to do through the health equity and quality lens. So it's just adding a component to your training program, but also to ensure that you've got processes in place and policies that are helping you to target this. And there's some examples here, again, of different tools that you can use to support the progression of this work. I'm going to hand over to Jade.
Wonderful. So we are now into 2.3. So here there is one partially mapped and 1, 2, 3, 4, 5, 6 not mapped. So the partially mapped is 2.3.3, and all the other ones do map, which is great. So 2.3.3, service providers shall implement systems to determine and develop the competencies of healthcare and support workers to meet the needs of people equitably. So having that equity focus, and then 2.3.6 through 7 relate to collecting and sharing high quality Māori health information, and also investing in the development of organizational and healthcare and support worker health equity expertise. Those are quite new. The other ones, which are currently not mapped, although these do link back for the consumer engagement criteria within the 2008 standard for residential for mental health services, these again are only applicable to residential mental health services. Mental health services continued. And these relate to involving people, service users into the system itself. And then the other 2.3.8, 2.3.9, these are new. So this is promoting healthcare and support worker well-being in a positive work environment, as well as demonstrating people with lived experience the service participate implementation, monitoring, and evaluation. So really trying to bring people and whānau into the entire improvement process for service delivery. All Right, now we'll go into a little bit more detail about those new and / partially new areas. So within the developing competencies of healthcare and support workers, we have a number of guidance for relevant for all providers on what this can look like, relevant to the types of services being provided. This includes recording, healthcare and support workers competency, and also requiring staff to complete cultural competency training is another example of how this can be done, and also considering the cultural makeup of your workforce. So just having a bit more data to support that updated requirement. So new one, this one's linking to sharing high quality Māori health information, where some of the guidance that is currently there looks to encourage staff to participate in learning opportunities that provide them with the most recent literature on Māori health outcomes, health equity and quality, and being able to use this within and learn with their peers. Development of expertise in Te Reo Māori for all staff, and quite other few examples as well. For 2.3.7, looking at investing in the development of organizational healthcare and support worker health equity expertise, so looking a bit more broadly how those inequities may be managed for Māori and other groups, and identifying the difference between inequality and inequity, which is very reflective of today's models of care. And further identifying policies or service designs that increase inequities for vulnerable populations, which include Māori and Pacific peoples, and trying to address those. So some good general guidance and some good direction on where to get some more information as well. We have sector guidance for 2.3.8. Training and support performance competence of healthcare workers are related to legal obligations for a healthy work environment. And we support providers to have safe systems of work for staff. We don't always, you'll notice there isn't always guidance for all the sector for each criteria. This was a decision made during development. It was decided you don't, just as there are in the 2008 standards, there is not necessarily guidance for every single criteria. However, these are areas that we will keep an eye on as we run the pilots to see if we do need some more targeted guidance, and we can, these as that's the good thing about having these on the ministry website, is we can update these as needed, and we can also hear from you all if you feel like you have a really good example or guidance that should be included. So opportunity there, and we'll be keeping an eye on that. Let's see. So now going to, sorry, let me catch up with my notes. 2.4. Yep. There is, let's see, we have one partially mapped. So this is on about healthcare and support workers and supporting them. So this particular one is information held about healthcare and support workers shall be accurate, relevant, secure, and confidential. Ethnicity data shall be collected, recorded, and used in accordance with the Health Information Standards Organization requirements. And then we have some more guidance on that. I know this. And then we also have, 2.4.7, healthcare and support workers shall have the opportunity to be involved in debrief and discussion and receive support following incidents to ensure well-being. So trying to take a bit more care of those who support service delivery. So in terms of the guidance for HISO, we refer directly to some of the data protocols that we have on the Ministry of Health website. And also recommend that some ways in which providers can ensure that their data is up to date and it reflects roles, gender, age range for meaningful analysis and interpretation as well. So trying to use the power that is data. For 2.4.7, some of the guidance, we look at encouraging service providers to develop policies related to debriefing processes following incidents, particularly for that includes and how it includes healthcare and support workers, and that people, another example, are encouraged to make full use of available health, legal, and support. Is
This is me.
Wonderful.
Thank you, Jade.
No.
So 2.5 is the last subsection for this, the last subsection of this section 2 around workforce and structure. So this one is about information, so about information management. And you'll see there that there's no new or partially new criteria here, and so it maps back well to information management parts of all the standards that we're bringing in together here. So we will address that in the more targeted sessions, or we can answer questions if you have information about that. But they're within these 3 criteria. They're all new, and they're all not familiar. They're just, the wording might be slightly different, and certainly the numbering is different. Okay, just handing back to Jade there.
Wonderful. So we've just talked a lot about what's new, what's not new, and what is partially new, and where to get some guidance on how to manage those changes, or start becoming familiar with what might be required. So now I'm going to talk about the general overview plans HealthCert has for we, the ministry, have for implementation. So as I mentioned, the standard and sector guidance have been published. We'll start there because I'm just so excited that happened. We are in the middle of that first bar online workshop. So we're running these lunchtime sessions for each section, getting pretty good attendance, which is exciting. And these are the general overview for each section. And it's open, the intended audience is meant to be relevant for all different service types and lenses, if you will, consumer, health professional, etc. The next thing that we will be turning our minds to, as Christine touched on earlier, is the piloting the 2021 standard. And so we've already discussed that in detail. Then following that, we will be running targeted sessions and and attending conferences. So the targeted sessions will be open to absolutely everyone, of course, but we will target them based on the intended audience. So that might change how the messaging is delivered. So for example, we'll provide one by service type. So we'll provide it in terms of what is mapped, unmapped, new from an age residential care provider's perspective versus the residential disability provider's perspective. For designated auditing agencies, the lens will more be about how we expect them to audit and those sorts of things, that consistency. And then for people whānau, the focus will be a bit more in terms of what their rights are and empowering them to understand what type of services they should expect, and using the standard from their view as a lever, because that's important. We're partners here. We will then be running, as Christine mentioned earlier, we will be running this survey to check in and test the appetite of the sector to see how comfort levels are with the standard, how, based on the sessions that we have run, what gaps are there, what further things would you like us to dive into a bit more, and then we'll be running targeted workshops based on that feedback and tailor those. So watch this space. We'll provide more information about that as we have evidence for those. And that will all be in preparation for the 28th of February 2022 for the standard to come into effect. Perfect. So these are the upcoming lunch sessions. So we have 3 remaining. Section 3, Pathways to Wellbeing, Section 4 and 5 running together because they're quite short sections, and then Section 6, Restraint and Seclusion. And without further ado, we've now come to questions. So I'm